Welcome to She Wears the Pants, the podcast where women build companies that can hold their calling. I'm your host, Ashley Deland, business advisor, multi-business founder, and startup investor, guiding women to scale with structure, strategy, and self-mastery. Every week, we go behind the scenes of high-growth, women-led brands to talk about the real work, the identity evolution, the leadership required, and the strategy that actually sustains success. If you're ready to build a business and life you love, you're in the right room. So welcome to She Wears the Pants podcast hosted by me, Ashley Deland. Today we have the amazing guest, Dr. Amy Louis-Bayliss. Dr. Amy Louis-Bayliss has been an MD for almost 20 years now. She has been working in the Greater Toronto area since 2011 as an emergency medicine specialist. She is an educator and an advocate for women's healthy aging, and her interest stems from years of painstaking effort and frustration in treating and managing illness in the ER once it was already too late. So Dr. Louis-Bayliss currently works as a menopause specialist in the Hamilton and Oakville area, and she is also the co-founder of Loom's Women's Health. So thank you so much, Dr. Amy, for being here today.
Thanks for having me.
You're very welcome. You are a powerhouse within your own field, and I would say in the world of women as well. Is there any specific advice that you would give to women who are entering your field in this day of age?
Great question, Ashley. Honestly, I think the best advice that I would give is don't be afraid to make change. Especially once you're in healthcare, as a physician, most physicians start their career and they do the exact same thing until they retire. And that's so different from most other careers. Like most other careers, you can pivot, you can move up the ladder, you can change. But, residency is a really long time. You pick your specialty for most people in their 20s, and then you're committed to that job for a really long time. And it took a lot of grit and determination to make a career pivot. And I was terrified. I thought I was going to be judged. I thought I wouldn't be able to do it. I thought I was a failure for leaving emergency medicine, that I couldn't cut it. And now that I'm, 3 years in transition and on the other side, I'm so glad that I took that leap of faith. And I'm so glad that I was able to create change for myself. And so really that advice piece is if you're thinking about making a change, if you're feeling like you're not satisfied in your position in healthcare right now, which is really common, you can reinvent what you're doing within the healthcare space and find that job satisfaction again.
Also, doctors experience the feel of failure. That's really good to know.
Acknowledging it is hard, but they do. They do. Everyone has imposter syndrome.
For sure. When did you know that this was kind of like, how old were you when you were like, that's it? I want to become a medical doctor. I want to be of service. And then how did you get into the ER, which is like the most bananas aspect of MD? Like, how did that come into fruition?
So I grew up with a father who's a physician, which is, a very typical story in a lot of ways. I actually really wanted to be a vet. I was really gunning for animal medicine, love animals. And this is a bit of a funny story. I spent a summer working up north, and there were so many chipmunks and squirrels that summer that by the end of the summer, I was like, I don't know if I could save all the animals. And I started taking some science courses. I actually started volunteering in an emergency department and then got a summer job doing registration in the emergency department when I was like maybe 19, 20, 21. And that really was it for me. I have always loved working in teams. I loved the team aspect of care that happened in the emergency department. It was exciting. There was a lot of, treating a problem. You got to see someone at their worst, you got to help them, and you got to make it better. And I loved that sort of quick decision-making that was involved. I was young. I didn't mind the shift work. I liked the education piece to the job. And so it was really that early exposure. And then when I went to medical school, I liked absolutely everything. Like it's kind of like when you travel and every place you go, you're like, could I move here? Like every rotation I did, I was like, oh, maybe I want to be an obstetrician. Oh, maybe I want to be a surgeon. And so emergency was really a place to kind of do it all.
Did you ever experience burnout with that kind of just, you're in that energy all the time, right? And it's not like beautiful, delicate stuff happens. Did you ever experience a moment where you were like, okay, maybe I need to pivot?
Oh, absolutely.
Yeah.
I mean, I worked right through COVID, and COVID was really, really hard. There was so much stress at the beginning over what it meant. Was I going to infect my family? What was I gonna like see when I went to work? I had significant issues with childcare, and I had two boys who were home from school for, almost a year. And the other thing that happened is so much regular care was canceled in the medical community, meaning, gynecology, a lot of gynecologists weren't doing regular gynecology. A lot of family practices really went to a virtual model. And so we had this massive swarm of patients coming to the emergency department, which continues. And it did pivot a lot of it changed for me a lot of what I used to love about my job. So my favorite parts of my job were the time I actually got to spend with my patients. And emergency, it's fast paced, but there's still opportunity for connection.
Yeah.
There's still opportunity to look and speak to, a woman who's having heavy bleeding or a miscarriage and connect with her, or a mom that's there who's scared about her sick baby. And instead of having that opportunity, the department was so overwhelmed that A, I couldn't do that anymore, but B, the doctor is the face of the healthcare system. And when the healthcare system is failing, the failure feels like it's on your shoulders. And so I was spending a lot of my time apologizing, like I'm sorry for this care. And I was spending a lot of time diagnosing disease states. I think that's really what I started to pay attention to, because people were so desperate. They were coming to Emerge because they couldn't get care anywhere else. And I was probably seeing that before, but it started to get worse. And I started thinking to myself, like, I'm in my 40s, like, what am I missing here? And it really started this like switch of like interest in prevention. Like, how can I get ahead of the educational piece? Like, how can I start educating women and men like before the disease takes place. And then through that sort of interest in disease prevention, I learned about menopause. And once I started learning about menopause and hormonal changes that affected women, I felt this, literally, it feels like a calling. And I know that sounds cheesy, but this job opportunity, or this ability to maybe create something new for myself, that maybe gave me the opportunity to educate again, that maybe gave me the opportunity to fill knowledge gaps that weren't there before, and maybe find fulfillment again in maybe a different way.
I love that, while continuing the human connection that you were craving before, right? So where
Exactly.
did that aha take you? Where did you pivot after that into?
So this actually took a while. I actually did a lot of therapy and a lot of coaching to even be able to make that decision. There's a lot of martyrdom in emergency medicine and in healthcare. And I don't mean that in a negative way. There's a lot of pride in being an emergency doctor. And to say like, this isn't for me anymore and I want to pivot was actually a massive mental hurdle for me. And actually took a lot of work to be able to do that. And I still actually sometimes struggle with shame when I see my colleagues, if I'm going to be honest. But I actually gave myself some time. I sort of took a big break from emergency and did some clinical medical work that wasn't maybe as mentally demanding. And I started taking courses. I gave myself the space to learn. I traveled. I went to, courses in the US. I even went with my husband. We traveled to Lisbon and went to a course there. I really just started learning as much as I could. And sort of started training at the same time. And I hummed and hawed in terms of whether or not I wanted to make this another career for actually a while. And part of that, once again, was that imposter syndrome, that like, what are people going to think? I was an emergency physician. I'm not a gynecologist. But I thought let the people who do the college, the Royal College, who decides who gets to work and who doesn't get to work, decide. And I created a retraining plan. I submitted it to them. There were so many women in the menopause space that agreed to mentor me, which was amazing. This is a really, really, really supportive community. And I've really spent the last couple of years doing that. And now I'm practicing in the menopause space, which is amazing.
Can you tell us a little bit more about that and how it's transpired?
Yeah. So as I said, I had some fantastic mentorship. One of those was Dr. Wendy Wolfman, who is a menopause guru in Canada. This woman has dedicated her entire life to mature women's health. Another one was Allison Shea in Hamilton, and they really encouraged and supported me, and then helped me really set up small practices right now. So I work in Hamilton, Ontario. I'm actually in a sexual health clinic, and I do menopause care there. And then I work with a colleague in Oakville, and I help her with her menopause practice right now, which is great because there's still some, teaching and mentorship happening.
Yeah, of course. What do you find is the most common thing that women don't know about menopause yet? Because it's not it's not a narrative that a lot of people have. I happen to be surrounded by it because I have a lot of clients who are going into that space right now. But what is something that's not very well known about it?
So there's a couple of things. So one is the symptoms that cause menopause, the symptoms that are part of the menopausal process are not just hot flashes. And I think probably one of the most common complaints that I hear from women in my community and from my friends and family are this feeling of just not feeling like yourself and not really able to pinpoint what that means. Maybe you're not having drenching night sweats or hot flashes, but you just don't feel like yourself. And it's actually a very, very, very significant menopause symptom. It affects over 60% of women. And it's actually when you tease it out, it's a feeling of anxiety, a feeling of irritability, or reactiveness in conflict that maybe you didn't have before. And these mood changes are really, as a result of low estrogen on the brain. It's actually a neurologic phenomenon. And women go a really long time without addressing it because they think to themselves, what's wrong with me? And don't recognize it as part of the menopause process. I think there's also a lot of misinformation in terms of treatment options. So, there's a big wave right now in which women are learning a lot more about hormone therapy, which is amazing, but there's still a lot of misinformation around that. So perimenopause is the period of time leading up to menopause, menopause is when it's been 1 year since you've had a period. And perimenopause can last 4 to 10 years. And there's a lot of common thinking actually among women and healthcare that you can't start any kind of treatment, you can't get any kind of support until menopause has happened. And so women will go 4 to 10 years suffering without seeking care.
So what can they do instead? What would you advise them to do to not have to stay in that period of 4 to 10 years? Are there certain tools that they can add to their toolbox?
So yeah, so a couple of things. One is you can advocate for yourself to see your doctor. Not all doctors right now are, I would say, well-versed in menopause care, but a couple of pieces of advice that I give is one, make an appointment saying that you're coming to talk about menopause or perimenopause. And the reason why I say that is this deserves an entire appointment. This should not be an add-on to a conversation or maybe a symptom or something else that you're having. It deserves its own appointment. But two, doctors will often read around cases that they may not understand. And so maybe if your doctor is primed to think, oh, someone's coming in to talk about perimenopause, they may read up a little bit about it a little bit more and get themselves a little bit more educated. I also think this menopause transition is a time that makes women more vulnerable to disease in terms of heart disease, risk of bone disease, and risk of weight gain. And so I really do think this is a real time to sort of sit down and think to yourself, what are the lifestyle interventions that I'm making time for right now in terms of, am I moving my body? Am I eating a healthy diet? Am I paying attention to my sleep and my alcohol intake? And starting to recognize that looking after yourself and making time for self-care is actually not selfish. It's women say to me all the time, I don't have time. I'm looking after my kids. I'm, working full time. I'm dealing with aging parents. I don't have time, but this is a critical opportunity for you to really set yourself up to be healthy for the next 10, 20, 30 years. And when you look after your health, you're actually not just doing yourself a favor, you're doing your kids a favor in terms of looking after you as you get older. You're doing your spouse and your partner a favor. And, we already know that good lifestyle choices help with stress reduction and management. So really taking the time to figure out how you're going to include lifestyle interventions, I think is another really important piece to healthy aging.
I love that. And you're really trying to change the narrative in the Canadian landscape around women's health and really having every woman feel seen and heard, which kind of brings me to you and your vision for Loom, Women in Health, which is elevated healthcare for women by women, female MDs. Can you tell me a little bit about the birth of that amazing business?
Yeah, I would love to tell you about it. Loom is a women female MD led clinic for the aging woman. It's a medical clinic with the first clinic opening in Toronto, hopefully by the end of this year. And it was really born out of recognizing that mature women's healthcare and the time that women deserve is not being met in our current healthcare system. So right now, I mean, to even go, like I do menopause care right now, and it takes at least 20 to 30 minutes to be able to have a real conversation with women. And our family health right now and family medicine, it's really been created to see patients in like 5-10 minute increments, and women deserve more time. This takes more time, and I've advocated for menopause billing codes, but this has not happened. I do think our provincial government should be remunerating doctors to incentivize them to spend time with aging women. But we're trying to trailblaze a new way of healthcare for women, a way where women are seen and they're heard, and their very specific medical needs are met with, evidence-based care. And we're really looking to create a circle of care. So it's not just the physician. There's, pelvic physio, there's dietitians, there's focus on bone health and heart health and brain health, like really a comprehensive approach. The other area that is very underserved for women is sexual health care. There's really not a lot of opportunity for women to get the support they need if they're having issues with pain, with sex, if they're having low libido or loss of interest in having a healthy sex life. And I think we're going to be sort of trailblazing a way of care in that area as well.
I love that. It's so, so absolutely needed. And I'm so thankful that women's voices are starting to get heard, and women like you are building businesses and spaces and havens, quite literally, for them. I kind of want to take it back to the beginning where we talked a little bit about limiting beliefs, because as somebody who might not know you and just be tuning in, they see this drop dead bombshell who is a doctor, right? Who has, it's our time. And also you're a co-founder and you have what looks like the perfect life, right? I want to talk about the limiting beliefs and kind of giving other people permission that if they have them, that it's not rare, and also it's something to overcome. And I'm also a huge advocate for therapy as well. But what are some of the resources that you kind of tapped into to acknowledge and maybe release, or just acknowledge, and some people like to hold on to them, those limiting beliefs? Like, what did you do to kind of acknowledge that they were there, but then work with them or release them?
So I started off by listening to a lot of podcasts about the Life Coach School. I forget, I'm terrible. I should be able to like rhyme off who organizes it, but she's a coach in the United States. And one of the best advices is one of my colleagues who also, her name's Dr. Sasha High. She left a hospital-based medicine and paved her own way. She does incredible work in like weight and obesity medicine space. She told me about these Life Coach School podcasts, and she was like, start on episode 1. And so there was like 400 episodes, and Brooke Castillo, that's her name. Sorry, the brain fog. And I got it. And I literally started with episode 1 and started listening to it. And I don't know that these are like the best podcasts to listen to, but I think a huge part was even knowing what limiting beliefs was. Like, to be honest, the first time I heard it, I was like, oh, and then I started doing some coaching.
Yeah.
And, I would say, to the coach, I'd be like, I can't cut doing a merge, or a merge is so hard. And she would be like, well, is that true? And I would say, yeah, a merge is hard. And she would be like, well, actually, no, that's not a fact. That's your belief. And so really starting to identify what thoughts were actually true facts and really starting to recognize what was a belief, I think was really the first part. And then I started doing downloads of some of the limiting beliefs or the thoughts that were preventing me from making this step that I, in my heart, knew I wanted to make.
Mhm.
And then I think the other part was I really surrounded myself with cheerleaders. Like I have a lot of wonderful women in my life who really believe in me and really help correct when my thinking, isn't serving me, really isn't serving me in a way that allows me to be my best version of myself.
Yeah. And you've kind of experienced it all. I would say like more the MD is like, we'll call it corporate. And then obviously with successful entrepreneurships, what do you find like the biggest difference is in how you have to operate between the two? Like, do you have to like go to entrepreneurship hat and then, corporate hat on top of mom hat and wife hat? Like, what do you feel is the biggest difference?
Well, the biggest difference in the switch in what I'm doing now is with emergency. And when I did this career for over 10 years. When you left the emergency department, sure, you'd be upset about you could think about a case that you saw, or maybe you would think about a patient, but when you left, you left. Really, the difference in entrepreneurship and what I'm doing now is it's really unrelenting. There are like having to learn to create boundaries has been something that I've never had to do before in this way. Like, you're a mom. Like I could do this 24/7. It never goes away. And so learning how to set boundaries in my time away from work has been a massive challenge for me. The learning, like the business, doctors are not great business people. And so the business learning has also been amazing, and that I'm loving learning new content and it's been exciting to read and learn and talk to other women. But the boundary issue has definitely been the biggest hurdle to get over. Like I always say, someone the other day was like, if you could get in a room with anyone, who would you want to get in a room with? And I was like, I'd want to get in a room with a mom with 2 kids who started a business and on the other side. And I want them to tell me how they managed. I mean, really, that's
Yeah.
that's it. It's the boundaries. It's when do you turn it off?
Which is so interesting because you would think as an ER doctor right away, I would be like, how do you just like take off the scrubs and drive home after seeing everything that you just saw? I would think that that would be harder to turn off. But do you find that you had to take a little bit of emotion or turn into a different person in order to just step into that every night in the ER? Like that must have been a lot for you to be stepping into and just getting bombarded all night long. Did you have to turn a little piece of you off?
Oh, I will be, there will be a lifetime of therapy getting through this. You
Yeah.
are groomed. You are groomed to be able to handle trauma after trauma after trauma. And when I say that, I mean emotional trauma after emotional trauma, because you can literally be on shift and watch a 19-year-old die in front of you and then have to go see a 5-year-old with a bellyache a minute later. And then go, sew up a cut on a finger 5 minutes after that. The emotional compartmentalization is trained into you, and it needs to be. You can't be a functioning doctor if you can't move on from a traumatic event. And we're recognizing that now, like this is 20 years later, that's probably not healthy. And there's a lot of time and investment being put into trauma therapy and like the actual processing of trauma that happens in the hospital scenarios and like how to address it. But we still have a very long way to go.
Do you think on a human level that subconsciously that seeps into your energetic system as somebody like, do you think you're housing that anywhere within you as a
Oh,
doctor?
absolutely. I mean, I'm working through it, but I have had 20 years of being groomed to numb trauma. And, for example, I lost one of my best friends last year, very unexpectedly at 41. And I had a really hard time feeling the feels, because I've been trained to numb, 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 numb. And so I'm working on it.
I think that's a really interesting topic because, as you know, I lost Mary, who was my best friend overnight. And I had so much trauma growing up that I, like you,
Mhm.
had a hard time feeling it. And then when I did, I couldn't like put myself back together. And I, after that, started having so many cysts on my ovaries and understanding how that pain translated within my body. Is that anything that you speak to when you see patients? Are you ever like, maybe you should talk about the trauma that's being housed in your, or, how do you correlate the two? And do you ever talk about it with patients?
I mean, I talk about it all the time. So, for example, one of the very common complaints, during my time in emergency was chest pain. So many women, or headaches, and i- you do all the tests and the tests come back negative. And, these women are having chest pain. These men are having chest pain. And the question is like, why? And like our bodies physically manifest, we physically will manifest stress and trauma if we do not emotionally process them. We know this.
Do we?
We do this. What I mean is, we as a medical, we do as a medical,
Yeah.
we as a medical society understand this. My son last night was like asking me about somatization disorder, which is when literally you can have experienced so much stress that you may wake up one day and be paralyzed. And and I mean, these are very dramatic cases, but
Yeah, for sure.
he's very curious. But we know like that we know that the brain has the capacity. If the brain is not having its emotional needs met, it will manifest itself physically for sure.
Is he following in your footsteps? Are we doing like a dad to daughter? And does he want to come into this field as well?
I don't know. I think he's just more curious about it.
Mhm.
They just went through puberty, and the questions have been hilarious. He has questions, but then he doesn't want me to say the words.
Yeah, exactly.
I said period, and he was like, "Mom." Period. So I'm not sure.
I love that. Okay, so I want to tap back into the fact that you are opening a bricks and mortar in September, October of 2024. And for some of the women listening, they're going to be opening their first established brick and mortar soon. What are some of the challenges that you're facing kind of right now that you weren't expecting to face? I mean, we know the permits and we know, the government has to be involved. Anything on a maybe even a personal side that you weren't expecting would arise when you're taking on this kind of journey or this kind of entity.
Hmm.
I've flipped, I'll say, for most of you guys, you don't know this, but I used to own a vegan restaurant, and Amy was one of my
Loved
customers.
it.
Yeah. And that was my one, two, I think my fifth bricks and mortar location and my fifth and my last. And everybody was always like, what was the best and what was the worst? And I was like, oh, the worst was having to manage employees. The
Hmm.
hard, easy. But I also didn't expect the fact that I knew the rent and I knew bylaws but the bricks and mortar was, I never really thought about being that available all the
Hmm.
time and just being so peopled out that it energetically sucked me, which I didn't really expect. Are you kind of encountering any challenges right now, even though it's not in operation yet?
I mean, I already spoke to the boundaries. I think like just creating the boundaries. I mean, I do, want to be present for my kids, and trying to do the female entrepreneur and be mom and retrain all at the same time, is a lot. I mean, I'm really still enjoying so much the relationship building side of it. And I think it's because women are like, when I talk to women, they're feeling heard in a way they've never been heard before. And so that still is an incredible feeling. I think honestly, what the part that's probably driving the biggest hurdle for me right now, and it still speaks to the limiting beliefs, is just the fear of failure. The like, it was a big career change. Are all my old cool colleagues like wondering, like, are they judging me? What if it doesn't work? And so I do think really it's still that limiting belief of the fear of failure. And it's certainly not enough to stop me from continuing on. But it also, I recognize it doesn't serve me.
And I'm sure a lot of people wouldn't even think that that would be something that would come up, right? And it is such a normal habit and limiting belief for anybody kind of jumping into entrepreneurship. Okay, so for the sake of time, I have two more questions. The second last one is, where are you going to be in the next 5 years? Like, what's the vision for not just women entrepreneurship, but also motherhood and also wife and also MD? Like, what are we aspiring? What's the vision here?
Oh, I love this question. When I think about the next 5 years, I actually am really cognizant of it because I only really have 5 more years of my oldest son being home. And so I actually do spend a lot of time thinking about what that looks like. I think about like, what does travel look like as a family? That's something that brings me a lot of joy. I think about the opportunity I have to change the landscape for women's health.
Yeah.
And it's so exciting and so thrilling and such a movement that I want to be a part of. I think about what the trajectory of accessibility for women's health looks like and how I can contribute towards that. And then I do think about, eventually finding balance. I do think about that, like a way of finding a balance in which I can have a leadership role, be an educator, like see patients, but also maybe get to read a book again. I'd like that.
So our signature She Wears the Pants question, looking back on your journey of wearing the pants per se, what message do you want to relay for future generations of women in business?
Take the risks.
Mm-hmm.
Take the risks. If you're thinking about it, if you're confident, it's a great idea. Push through the limiting beliefs like I've tried to do in terms of not like listen to that inner voice and don't let the noise of the you can't do it stop you from taking the risks. And I think the other big one for me is surround yourself with women and partners and family that really lift you up, that really share that vision and see the best version of you, even sometimes when you can't.
Yes, I love that so much. You are so insightful, so valuable, and you are quite literally changing the trajectory of women's health in Canada. So we are all so thankful for all of your energy and all of your effort. And thank you so much for filling us up with so much value today.
Helpful.
It was. Where can people find you when they want to know more information?
Yeah, so I do a lot of advocacy work on a Instagram platform called It's Our Time Canada, and it's really focused educational content on the aging women for aging women from a Canadian perspective. And then if you're interested, you can check out loomwomenshealth.com, which is our website. And we do a fantastic, if I may brag, monthly newsletter that's really well curated educational content on aging. It's non-proprietary. You can sign up and it's a great place to learn more about, the message and the educational content we're trying to share.
It actually is. I am a subscriber and it is phenomenal. And as somebody who's quite the critique, even I was like, ooh, all right.
I'm very proud of it. Yeah, thank you.
As you should be.
Yeah.
Okay, well, thank you everybody for tuning in, and we will see you next week. Take care.
Bye. Thank you.
This was She Wears the Pants, where women rise into what they're meant to hold. If this episode moved you, changed you, or challenged you, send it to a woman you want to see rise. Make sure you're subscribed so you never miss an episode. And if you're ready for deeper strategy, identity expansion, and high-level support, you can find me on Instagram at Ashley Deland. Until next time, keep leading boldly, building intentionally, and becoming the woman your calling requires.